We actually recently published a very nice article, really defining and sharing a lot of the information about what we found, using, RNA sequencing approaches in bulk RNA to really try to understand, the differences that we were seeing in response to our single-arm, Durvalumab study that was given in conjunction with standard of care chemotherapy. And one of the things that we actually found was actually really interesting is that we had a lot of signals for cytokines and chemokines. And so we wanted to really just follow up on that and see if there was, some signal as well that's confirmatory for the protein levels of that, since we were mainly looking at the RNA for the paper that we published, and we just wanted to see, okay, well, this is still hold true when we look for these cytokines in really the serum of the same patient cohort. And so what we found was actually quite interesting. So not only did we find that there was very specific cytokines that really were associated with residual disease, but there were also ones that were associated with PCR. And most interesting to me, because this is my area of research for my research lab, is I was interested in how this actually impacted, or what was the association with this with individuals who had treatment emergent adverse events, right? So these could be your immune-related, adverse events, or things like your thyroid disease, your pneumonitis and things of that nature. And if we could, use possibly some signals to try to, build like signatures that can help us, define which patients are going to have these particular types of events. And one of the things that we did find was that, yes, we do have specific, immune cytokines and chemokines that are actually associated with, immune-related adverse events. And that, this could be actually a good source for us to try to tease out early in something as simple as, the patient's serum, to try to see if, this is something that we can, predict, early on, and sort of like, do something, pre-treatment to, try to, anticipate or try to reduce the level of effects that they're having. But this was literally the crux of the research that I was doing or shared today or a couple of days ago in the poster.